Thank you, Chairpersons. I present this paper on behalf of Dr. Sneha Batra, who was supposed to be the presenting author. She's met with an accident, and therefore I'm here to present this paper on her behalf. Clinical outcomes of binocular implantation of a trifocal intraocular lens after cataract surgery. And we have no financial interests. This is the era of cataract surgery where we are doing cataract refractive surgery. And multifocal lenses are considered to be one of the best solutions. However, they have limitations of glare and halo, poor intermediate vision, pupil dependence, and loss of contrast sensitivity. And therefore, in comes the trifocal, and why? This is a combination of two diffractive structures. They have a convoluted diffractive step design and less loss of light, better contrast sensitivity. This is how the two bifocal diffractive structures are combined, and thus gives both the intermediate, the distance, as well as the near vision. And thus the advantages of the trifocal, it gives a very broad range of vision of 33 centimeters to 100 centimeters. So we did a study. It was a retrospective non-randomized study, 15 months of duration, and we studied 56 eyes of 28 consecutive patients at a tertiary level institute in Kolkata. So the inclusion criteria was patients with cataract in both the eyes, not operated before, and a previous intraocular surgery was an exclusion criteria. Astigmatism greater than 1.75 was an exclusion criteria. So the examination protocol was a standard pre-operative protocol, and we also recorded the contrast sensitivity, the intraocular pressure, axial and keratometry, slit lamp, and indirect ophthalmoscopy. Intermediate vision chart was done, and vision at 67, 80, and 100 centimeters were recorded. The Pellier-Robson contrast sensitivity chart of 1 meter was also scored. Surgery was done by one particular surgeon using the standard bimanual phaco-chop technique. IOL was inserted, and a post-operative regime, which was standard to all patients, was followed. The visual acuity was assessed, contrast sensitivity, and the quality of life questionnaire were assessed. A statistical analysis was done, and the standard deviation was calculated, a pair t-test was done, and the differences were considered statistically significant when the p-value was less than 0.05. So we attained the results, and the mean age of the patient was 65 years, plus minus. 90% of patients showed a spherical equivalent of plus minus 0.5 diopters at 6 months after the surgery. The results, all patients had a binocular uncorrected distance visual acuity of 0.1 logmar, binocular uncorrected intermediate acuity of 0.1 logmar or better 6 months after the surgery. 85% achieved a binocular uncorrected near vision of 0.2 logmar or better. This was the comparison of the pre-op and the post-op, distance and near, the contrast sensitivity, which shows statistical significance, and the results of the patient satisfaction shows 96.43% high regarding the visual quality. So the discussion, the visual acuity outcomes confirmed the percentage of spectacle independence. Other workers in this field, Vergam et al., reported spectacle independence in 100% of distance vision and 80% for near vision with the fine vision IOL. In our study, we report 90% for the distance vision, 85% for the near vision with a 6-month follow-up. Diveris reported outcomes of the trifocal are good for distance, near, and vision, similar to the outcomes of the multifocal. Furthermore, trifocals IOLs enhancing the intermediate visual acuity was noted. They showed that 38.2% patients were dissatisfied after implantation of the multifocal and their experience of photic phenomena. On questionnaire, 96.43% was happy. So to conclude, the trifocal implantation provides good visual acuity for distance, near, and intermediate vision, good spectacle independence, and minimal photic phenomena. So this is a happy selfie vision. Thank you for your patient hearing.
Thank you, sir. I think even though it's you are not you are not mentioned about the company part. Which company can I ask?
It's the Fine Vision.
Fine Vision.
Fine Vision.
So did you have comparison with any other trifocals available in the market?
No, it was just a retrospective case series of one particular trifocal lens.